Antimetabolites. Folate antagonist. Methotrexate. Methotrexate is one of the most commonly used anti-cancer drug. It is a CCS drug and acts during S phase of the cell cycle. It has anti-neoplastic, immunosuppressant, and anti-inflammatory effects. Mechanism of action. Methotrexate structurally resembles folic acid. It competitively inhibits dihydrofolate reductase enzyme and prevents the conversion of DHFA to THFA, thus depletes the intracellular THFA. Tetrahydrofolic acid is necessary for the synthesis of purines and thymidylate, which in turn are necessary for DNA and RNA synthesis. Methotrexate is well absorbed after oral administration, can also be given intramuscular, intravenously, or intrathecally. It is bound to plasma proteins, poorly crosses the blood-brain barrier, and most of the drug is excreted unchanged in urine. Methotrexate is the drug of choice for choriocarcinoma. It is also used in acute leukemias, Burkitt lymphoma, and breast cancer. Low-dose methotrexate 7.5 to 25 mg once weekly is used for rheumatoid arthritis. It prevents joint erosion. It has anti-inflammatory and immunosuppressant effect. It is also used in psoriasis, inflammatory bowel disease, and in organ transplantation. Adverse effects. Other adverse effects are megaloblastic anemia, pancytopenia, hepatic fibrosis, etc. Drug interaction. Salicylates, sulfonamides, tetracycline, methotrexate. These drugs displace methotrexate bound to the plasma protein, increase its free form in the plasma leading to its toxicity. NSAIDs and sulfonamides potentiate methotrexate toxicity by interfering with its excretion. Folinic acid rescue, leucovorin rescue. The toxic effects of methotrexate on the normal cells can be minimized by giving folinic acid. Availability of folinic acid has helped the use of very high doses of methotrexate for better anti-neoplastic effect. After a few hours of methotrexate therapy, leucovorin is given. Folinic acid is the active coenzyme form. It bypasses the block produced by the methotrexate and rapidly reverses the toxicity. This method is called leucovorin rescue, folinic acid rescue. Purine antagonists 6-mercaptopurine 6-MP and 6-thioguanine 6-TG. 6-mercaptopurine and 6-thioguanine are activated to their ribonucleotides, which inhibits purine ring biosynthesis and nucleotide interconversions. They are CCS drug, act in S phase of cell cycle. 6-MP also has immunosuppressant action. 6-MP is administered orally and has poor penetration through blood-brain barrier. It is metabolized by xanthine oxidase and its metabolite is excreted in urine. Allopurinol interferes with the metabolism of 6-MP by inhibiting the enzyme xanthine oxidase and increasing the anti-neoplastic effect of 6-MP. Therefore, allopurinol is frequently used in cancer patients receiving chemotherapy to prevent hyperuricemia and to reduce the dose of 6-MP, thus reducing its toxicity. 6-MP is used mainly in acute lymphocytic leukemia. Bone marrow depression is the major adverse effect of 6-mercaptopurine. Pyrimidine antagonists. Fluorouracil 5-FU. 5-fluorouracil is activated to fluorodeoxyuridine monophosphate FDUMP. This interferes with the DNA synthesis and functions by inhibiting the thymidylate synthetase enzyme. It is used in colorectal, upper GIT, breast and ovarian carcinomas. Plant products. Vinca alkaloids. Vinblastine and vincristin are derived from the periwinkle plant. They are CCS agents and act during M phase of cell cycle. Vinblastine and vincristin have the same mechanism of action but differ in anti-tumor spectrum and toxicity. Mechanism of action. Vinblastine and vincristin bind to beta-tubulin, drug-tubulin complex, inhibit its polymerization into microtubules, no intact mitotic spindle, cell division arrested in metaphase. Uses and adverse effects of vinca alkaloids. Vinblastine uses Hodgkin's disease, carcinoma breast, testicular tumors, And toxicity, bone marrow suppression, anorexia, nausea, vomiting, and diarrhea. Vincristine uses childhood leukemias, childhood tumors, Wilms tumors, neuroblastoma, Hodgkin's disease. Toxicity, peripheral neuritis with parathescia, constipation. Vincristine has minimal myelosuppressive action. Taxanes. Paclitaxel is a taxane derived from the bark of western yew tree. Docetaxel is a new taxane. Paclitaxel mechanism of action. Paclitaxel binds to the beta tubulin, stabilizes microtubules, formation of abnormal microtubules, inhibits mitosis. Paclitaxel is administered by IV infusion. It is useful in advanced breast, ovarian, lung, esophageal, and bladder cancer. The unwanted effects are bone marrow suppression, peripheral neuropathy, myalgia, and hypersensitivity reactions. Camptothecins. Topotecan, irinotecan are camptothecin analogs. Mechanism of action. Camptothecin binds to and stabilizes DNA isomerase 1 complex and inhibit the recycling function. The strand breaking action is not affected, thus produce the cell death. They are used in advanced ovarian, lung and colorectal cancer. The common side effects are bone marrow suppression and GI disturbances. Etoposide and teniposide. Epipodophylotoxin, they act in SG2 phase of the cell cycle. Mechanism of action, etoposide and teniposide form complex with the DNA and topoisomerase 2. The drug DNA topoisomerase 2 complex prevent resealing of broken DNA strand, cell death. Etoposide is used in testicular and lung cancer. In combination with other cytotoxic drug, it is also effective in non-Hodgkin lymphoma and AIDS-related Kaposi sarcoma. The side effects are bone marrow suppression, GI side effects such as nausea, vomiting, diarrhea, hepatotoxicity is seen with high doses. Anticancer mechanism of action. Anticancer antibiotics have direct action on DNA. D-actinomycin, doxorubicin, and daunorubicin bind to DNA through intercalation between the adjoining nucleotide pairs on the same strand of DNA and block transcription of DNA. Bleomycin binds to DNA, produces free radicals, which causes DNA damage. Actinomycin D. It is administered intravenously. It is mainly used in treatments of Wilms tumor, Ewing's sarcoma, and choriocarcinoma. Bone marrow suppression and gastrointestinal side effects are prominent. Mitomycin C. It is converted to a compound which acts as an alkylating agent. It is used in the treatment of GI tumors, cervix, and bladder cancer. It produces mainly bone marrow suppression, GIT side effects, and nephrotoxicity. Bleomycin. It can be administered through subcutaneous, intramuscular, and IV routes. It is used in the treatment of testicular and ovarian tumors in the Hodgkin lymphoma ABVP regimen. Its main side effects are hyperpigmentation of the skin, pulmonary fibrosis. There is very little bone marrow suppression, sparse bone marrow. Doxorubicin and daunorubicin. Daunorubicin is effective in acute leukemias. Doxorubicin is active against solid tumors. The side effects are bone marrow suppression, GI disturbances, and cardiomyopathy with CCF, hypotension, and arrhythmias. Mithramycin. It is an anti-cancer antibiotic that reduces the serum calcium levels by inhibiting osteoclasts. It is used in the treatment of hypercalcemia with bone metastasis. Enzyme L-asparaginase. It is an enzyme that is isolated from bacteria E. coli. Asparagine is an amino acid which is necessary for protein synthesis. Normal cells can synthesize asparagine because they contain asparagine synthetase enzyme. Cancer cells lack this enzyme, so they depend on exogenous source, plasma. L-asparaginase degrades asparagine to aspartic acid, hence neoplastic cells are deprived of asparagine, resulting in cell death. It is used in the treatment of ALL. Toxicity, hypersensitivity reaction with skin rashes, itching, urticaria, hyperglycemia due to insulin deficiency, headache, hallucination, confusion and coma. hemorrhage due to the inhibition of synthesis of clotting factors, pancreatitis. Miscellaneous agents. Hydroxyurea. Hydroxyurea acts in the S phase of the cell cycle, CCS drug. Mechanism of action. Hydroxyurea interferes with the conversion of ribonucleoside to deoxyribonucleotide by inhibiting ribonucleoside diphosphate reductase. This results in the inhibition of DNA synthesis. It is used mainly in CML, polycythemia vera, and psoriasis. The common side effects are bone marrow suppression with leukopenia, anemia, and thrombocytopenia. Monoclonal antibodies are used as anti-cancer drugs. For example, rituximab is used in chronic lymphocytic leukemia. It is given as IV infusions. Miscellaneous drug. Tyrokinase inhibitor imatinib used in CML. Adverse effect is vomiting, abdominal pain. Angiogenesis inhibitor bevacizumab vascular endothelium growth factor inhibitor used in renal cell cancer, lungs cancer, breast cancer. Adverse effect is bleeding. Epidermal growth factor receptor inhibitor geftinib used in non-small cell lung cancer. Adverse effect is rash, diarrhea. Hormones and hormone antagonists. Glucocorticoid. Because of their marked lympholytic action, they are used in acute leukemias, lymphomas. Apart from this effect, glucocorticoids have anti-inflammatory effect, decrease edema associated with tumor, produce feeling of well-being, suppress hypersensitivity reaction due to certain anti-cancer drugs, control hypercalcemia, increase the anti-emetic effect of ondansetron, granisetron, metoclopramide. Because of the above effects, glucocorticoids are useful in the treatment of various cancers. Estrogens. The estrogens are the physiological antagonist of androgens, hence they are used to antagonize the effect of androgens in androgen-dependent prostatic tumors. Phosphestrol is a prodrug which is activated to stilbestrol in prostatic tissues. Phosphestrol achieves high concentration in prostatic tissues, therefore is preferred in carcinoma prostate. Tamoxifen. This is an anti-estrogen mainly used in the palliative treatment of hormone-dependent breast carcinoma. Progestins. The progestins are useful in endometrial carcinoma. Anti-androgens. Flutamide is a non-steroidal agent that blocks the action of androgen at the receptor level. Finasteride. This blocks the conversion of testosterone to dihydrotestosterone by inhibiting 5-alpha reductase. Both flutamide and finasteride are useful for palliative treatment of advanced carcinoma of prostate. Finasteride is also effective in BPH. Aromatase inhibitors. They are used in hormone-dependent breast cancer in postmenopausal women. GnRH agonists. The pulsatile administration of these agents, buserelin, goserelin, and leuprolide, etc., produces a rise in follicle-stimulating hormone (FSH) and luteinizing hormone (LH). Continuous administration, however, suppresses the pituitary gonadotropins by downregulating GnRH receptors. These agents produce palliative effects in advanced prostatic and breast cancers.